100 nurses is a lot of nurses, and there's a critical shortage of nurses in BC, as I'm sure most people are aware of. So.
100 new police officers, 100 mental health nurses. That's what Mayor-elect Ken Sim is promising to improve policing and public safety in Vancouver. But some nurses working on the front line say his plan is unrealistic.
I feel like a lot of pieces are missing in this.
Maddie Beaumont is a registered nurse who works on Vancouver's downtown east side.
I'm not sure where he's going to find these 100 nurses, since the teams I work for struggle to maintain baseline staffing. Currently, you'd be hard-pressed to find a city organization that hired nurses. So I definitely would love to know which health authority is going to take on this plan. Are they going to be hired as an RPN or an RN, or what are the credentials?
I don't see it as being something that is possible, period.
Christine Gower is a psychiatric nurse, and besides the staffing issue, she believes mixing healthcare and policing doesn't work.
When we're talking about hiring 100 of each profession and pairing them up, that just, to me, I call it militarization of healthcare.
The BC Nurses Union also has questions about where Sim will find the nurses and how they will be deployed. Ken Sim talked about the details on Monday.
What we'll do is we'll provide the funding and the resources. Are they hired by this legal entity or that legal entity? Those are details that we will leave to the City of Vancouver and the Vancouver Police Department.
Sim's plan expands on the Vancouver Police Department's Car 87 program, which police say pairs a plainclothes police officer with a Vancouver coastal health worker to respond to low-risk mental health calls and reduce unnecessary hospital admissions. The VPD couldn't provide data on Car 87, but its own report describes its success based on the fact that other police agencies have adopted the model. The report says Car 87 clients continue with other mental health programs and show a decrease in violent crime, mental health apprehensions, criminal justice system involvement, and more. But Beaumont, a master's student in nurse education at UVic, won't be convinced expanding the program is the right decision until she sees more evidence.
My colleague and I, we both did university library searches for any quick evidence on Car 87, Car 88, and its efficacy, and we were unable to find a single article. So I am hard-pressed to say that that's evidence-based.
And Vancouver Coastal Health says Mayor-elect Sim still hasn't reached out to the health authority. In Vancouver, Kier Junos, City News.